everyone, and welcome to Brad Chat. My name is Jo McNamara, and I'm joined by fellow host Norman Joel Anderson.
Hi everyone.
So here we are at UKIO 2025, live in the pod box, and we've got yet another amazing guest. Would you like to introduce yourself, please?
Hi, I'm Katy Lonsdale. I work at the Royal Marsden Cancer Trust in Sutton, and I'm a therapeutic radiographer.
Woohoo! We love having therapeutic rads on. So tell me a little bit about why you chose to be a therapeutic radiographer and maybe what you've done in your career.
So at school I was really good at science. I had a real keen interest in biology, anatomy, physiology, and I also really enjoy speaking to patients or people. I just had that kind of, always really enjoy communicating with people. And we actually, I grew up near Sutton, and we actually had a couple of people from the Marsden come into our school and do a little presentation.
Outreach works
about radiotherapy. And obviously when you're 16, 17, you have no idea what radiotherapy is. It's always such a niche thing. So yeah, that kind of opened my eyes into something that was healthcare, but not doctor, nurse, or something that I really felt that I could hone my skills into, and that kind of technical side of things as well. So
amazing. Yeah. And what's your career pathway been like to the role you currently have now?
So mainly treatment, but I've done CT, I've done brachytherapy, I'm working on the new tomotherapy, so that's been really great too. I've done lots of paperless projects, so configuring smart view, mosaic, building systems, so I've really enjoyed doing stuff like that. So tried to take a lot of different skills and hone them in, really.
Amazing.
For anyone who doesn't know what tomotherapy is, what is it?
Tomotherapy is a helical arc system, so it almost looks like a CT scanner. Obviously the patient will move into the bore as we're taking the scans and doing the treatment, but the imaging capabilities we've got on Radixact are just amazing. They're almost like a diagnostic CT scanner. We've only just started treating on this since October. We're doing prostate, post-op endo patients, then we'll move on to, we've done online adaptive as well, so we were the first in the world to do that, so that's been really exciting, and obviously then we'll start building up more patient sites on there as well.
When you say you kind of treat different cohorts of patients, do you do research alongside those patients, or is it just a change in practice?
Yeah, so we have had our own little research role, so I'm doing some work with the post-op endotoxicity, so talking to patients, getting them to fill in some forms on their first day of treatment and their last day to compare the data. I've also submitted a poster for UKIO, which is essentially looking at the scans that we take for patients with artificial hip replacements.
Right.
And comparing them to the cone beam CTs on the Linux, because obviously with patients with metal in their body, the image quality is really poor, you get so much artifact, and I've just taken loads of images on our Radixact and just proved that it's so much better to treat those patients on there, as opposed to the cone beam CTs. You can really visualize your target volume, your organs at risk, even your nodal volumes, because I've been doing it on pelvis patients. It's just so much clearer, and for us as radiographers, that's just so important to get great image quality.
Talk us through your poster. What was it?
Essentially, I had, obviously, like I said, we only started treating in October, so we had a couple of patients with artificial hip replacements. So only had two. One was a rectal patient, one was an anus patient, and we, obviously because we needed to establish the protocol, because it's a new machine, new technology, we took a KVCT, a normal scan. On Tomo we've got 3 types of scanning mode. You've got normal, coarse and fine. So fine is your superior imaging quality, but obviously more dose to the patient. Coarse is less dose to the patient but worse imaging, scans, and normal is in the middle. So we took KVCT normal, MVCT course, and MVCT normal, compared those, and then we sent the patient to have the machine was having a service, so the patients had to go on to the Linux to have one fraction on there, and just comparing the scan from their cone beam CT. And yeah, I mean, if you look at the poster, it's really obvious to see. There's just so much artifacts from the cone beam CT, which as a radiographer, you're kind of really trying to see what you're matching to. So yeah, it's been quite interesting. And what I'd like to do is, we've got a few more patients now, prostate patients that we've had, maybe 2 or 3. So I'd like to just kind of develop that data and just keep collating and
incredible,
take it somewhere else.
Do you find that actually with doing the research, the treatment, kind of implementation of new treatment techniques, do you feel that kind of gives you the satisfaction within your job? Because I just know that sometimes we talk to radiographers and they're scared of doing research, but I always think, actually, it could be the thing that keeps you in the profession.
I think I really enjoy it. I'm always one of those people, I want to be doing more, as much as I can, as more as I can, whilst I'm interested, in things. And I think with research, it's just taking something that you find interesting. So like, I really enjoy the technical side of our job. Looking at something and taking it forward and or collating data or something that you find and bugs you at work, or something that you think you could improve on, or why do we do it this way, sort of thing. So yeah, I do enjoy it.
What should we expect from you in a year's time? Coming back to UKIO again?
I don't know. I always laugh when we ask that question, because it is so like a PDR.
Yes.
What's your objectives?
I think I'd like to present some work, maybe, or even at the annual radiotherapy conference this year. Maybe come back next year.
Estro.
Maybe, maybe. I mean, like I said, because we have just gone live with our online adaptive. So that could be something that we take to Estro for next year, because we've been the first to do it. So, and obviously we're going to start doing different patient cohorts as well. So there's always work to be doing and working on. So very exciting.
Well, thank you so much for joining us here
Thank
at Radchat.
you. Thanks very much.